rosacea, and first-time peelers. You have the Advance. This one is for fine lines and wrinkles, aging skin, loss of elasticity. You have Precision Plus. This one is our most popular peel. This one is going to be for melasma, pigmentation, hyperpigmentation, post-inflammatory hyperpigmentation. That one is really good for any sort of sun damage. You have Purify for active acne and like really oily skin, and then you have Purify with Precision Plus that basically mixes these two, and it's going to be good for acne and acne scarring. So like a lot of texture, you would use this one.
Okay.
These two right here have benzoyl peroxide in it, and it says all of the ingredients in these right here. So these have benzoyl peroxide in them, so they're going to strip that oil barrier and then allow for the 5 acids that are in all of these to penetrate into the skin. The 5 acids that will come in all of these are TCA, salicylic, phenol, retinoic, and vitamin C. So all 5 of the peels have those 5 acids. And then depending on which one you're doing, the original is just those 5 acids. The Advanced is those 5 acids and then a booster of those 5 acids. And so just more passes of those 5. The Precision Plus has the 5 acids plus hydroquinone and kojic acid. Purify has those 5 acids and then benzoyl peroxide. And then Purify with Precision Plus has the 5 acids, benzoyl peroxide, and hydroquinone.
Okay.
So, and that's all right here.
Yeah.
So you guys can, you know, laminate this, use it how you need, but it gives you all the information right here. And then the only people that cannot have it done, obviously, if you've had a treatment within like the last month, you want to, I mean, since it was just a week ago, especially if it was like 2-3 weeks, I'd say we could maybe do it. But 1 week, that's a no.
Okay.
If they have recent sun exposure,
No.
that's a no.
Okay.
If they're pregnant or nursing, they can't do it.
Okay. So any laser treatment a month apart, right?
A month apart.
Okay. Yeah.
Yep. And then if they've been on Accutane, they have to have been off Accutane for 6 months.
Okay.
And that's it. Yeah.
Okay.
Then everything is in here. The only thing you need is gloves. So you do double cleanse their skin with like a gel or foam cleanser. Nothing creamy or no oil cleanser and nothing exfoliating.
Okay.
And then, yeah, everything's in here for you. So you have the acid. You have the post-care kit that they go home with. I'll go over that in a sec. So the medicine cup that it goes in. Depending on which peel, you'll have the boosters that you pour the peel in here and then you put those in there. And then you also have the acetone prep and then the rough gauze to apply the peel.
Okay.
And I'll go over all this when our model comes in. But yeah, everything's in here. And then as far as the post-care kit, there's a QR code on the back. They can download this app and it will walk them through every single step of their post-care kit. So inside here, there's also a little pamphlet. The pamphlet does the same thing as the app. If they don't want to download the app, it's all right here. It goes over what to expect. So the first thing I do before I even start with them, before you even cleanse or anything, I go over this because you want them to know that it is flaking to heavy peeling. They may just get some flaking. It may not be like crazy sheet peeling just because the skin is only going to peel as much as it needs to.
Okay.
And then they'll experience the first night and the second day into the night is probably some irritation, itchiness, and inflammation. After the peel, the dark spots may darken. Acne may purge, meaning it may come out. They need to avoid sun exposure for 7 days. They are not to pull, peel, or anything with the skin that's peeling off. Just leave it alone, let it happen. And then they want to avoid any activity that causes excessive sweating for 3 to 5 days, and nothing with excessive heat. So no sauna, hot tub, steam room, nothing like that. No hot yoga. And then just avoid really hot water on your face when you're cleansing. And then just stay hydrated and keep your hands clean. Like when you're applying these products. It'll go over in here. Day 1 is the day of their peel. So they get the peel and then you leave it on. You don't remove it. It will stay on for 4 hours, and then they'll wash it off in 4 hours. We provide a cleanser in here. So they'll use the cleanser in here. They'll use the green, with this peel, they'll use the green post-peel towelette that's provided in here. And then they'll do just a pea size, a real small amount of the post-treatment cream in here. Then they'll repeat at night. But with this peel, after they cleanse, they'll do the white towelette, wait 30 minutes, do the green towelette, and then wait 10 minutes and do the post-treatment cream.
Okay.
That's tonight. Then tomorrow morning, it's just cleanse, post-treatment cream, the sunscreen. Those 3 things are in here. And then an hour before bed, they need to gently cleanse and do the same thing they did day 1. So night 1. On the first night, since they have to wait 4 hours to cleanse. So today, they'll wait until 5:45 to wash it off.
Okay.
These have to be 4 hours apart. So an hour before bed, if they wait 5:45, then at 9:45 they can do their hour before bed. It can't be any closer together than 4 hours apart on the first day. Okay. So if they come in at like 5 o'clock and get a peel, and then 4 hours later they're washing it off at 9, they'll move the nighttime one to the morning.
Okay.
Yeah.
Okay.
Yep. And then for the days after that, day 3 through 7, they're just using these products, none of their own. They're only using our cleanser, our post-treatment cream, and our sunscreen. That's just to make sure that there's no reactions or anything like that. If they start using their own stuff, we don't know the ingredients in it, so we don't know how it'll work with the peel.
Yeah.
Okay.
Okay.
So yeah. And then, and then this is just what they take home. They're good with this for 7 days, and they can come back every month and have a peel done. We say sell them a package of 3. They come in once a month for 3 months, and then they can do maintenance every 3 to 6 months after that.
Okay.
Sound good?
Yeah.
Yeah.
Like.
It's pressure sealed, so you want to make sure that you're being careful.
Okay. Peel and all this inside.
Yep, and then boosters.
Okay. So this 2 we need to put both inside.
Yep. That we'll pour this in here, and then both of the boosters will go in there.
Okay.
Booster 1 is the lighten booster, and it tells you what's in here. It's the same 5 acids that are in this. And then booster 2 is the brighten, and that's the one that has like salicylic. This one, the lighten one, also has that hydroquinone in there.
Okay.
Yep. So she double cleanses, and then the first thing we do is prep the skin with acetone.
Okay.
And you'll see they get kind of like almost dry and ashy.
Yeah.
You want that. You want all the oil removed.
Okay.
Hi.
Baba.
This, you want to put your thumb over it and then pull it down like that.
Yeah.
If you just pull it, this ring will come off, and then it's hard to get off this metal seal.
Okay.
When you release it, I'm going to take this off. When you release it, it'll pop like a champagne bottle. Oh, I did pretty good with that. So I did pretty good at not letting it pop. Yeah. But some of them will like pop. You'll hear it like a champagne bottle. So never open that like by their face. Always open it away.
Okay.
And then with this, there's a little tab right here. You can see that?
Yeah.
You're just going to take that and squeeze it in here. Just until everything's out. And then do the other one. Just keep squeezing. Everything's out. And then I just use this to kind of stir it around. Make sure everything's mixed up. And then this post-peel towelette, I push everything down. The acetone, there's a lot in here, so I make sure that it's pushed down just so it doesn't spill everywhere. And just unfold it. Ready?
Yeah.
And then good amount of pressure. So like you're petting a cat.
To decrease completely.
Yeah, to degrees.
So all the peel can be used face, neck, that's okay? Hands?
Face and neck. Anything below the collar, you'll want body.
Body, okay.
For hands, décolleté, back, yeah, you'll want
Hands and also for body.
Yeah.
This pack does not come
you
with
didn't get
body.
yeah,
Okay.
but you.
I need to order it
I'm gonna
separately.
go over your lips, so the smell is gonna be. Yeah, but with body, you can do arms, legs, bikini area.
Yeah.
You can do buttocks. Yeah, you can do surgical scars. You can do stretch marks. You can do anything. But I just keep going over. You can see she's starting to turn a little ashy. You just don't want them to have any oil on their face when you go and put this on. All right. And then just the rough gauze. Just take this out. Just fold in half like that. You'll dip it in and let it soak up a third of the way. And then just press it against the cup. You just don't want any dripping. And we'll go right in from one side to the other.
So this product can now go onto the eyelid
Yeah, we'll do one pass at the very end.
for the eye.
For the eye, yes.
Oh, okay.
Yep.
One pass only.
One pass only around the eyes. The neck, just 2 passes, and we'll do that in a couple we want to see how her face reacts. Because of the smell, you can always have like them holding a little hand fan.
Okay.
You doing okay?
Yeah, okay.
And then see how she got kind of pink? I'm just gonna watch that. Make sure it doesn't get more red. You just want to make sure that it's calming down. If she were to get really red and it just kept getting more red and more red and more red, I probably wouldn't do any more passes.
Okay.
If she were to start frosting in these areas, there are people that will frost on the first pass. If that were to happen, it's just one pass. And then that just goes
Yeah.
in the trash.
Okay.
Yeah.
That
and then
means she's going to start to peel already.
Yeah.
With one pass.
Yep.
Yeah.
Yep. And also, if she gets really frosty and red on the face, I wouldn't do the neck the first time.
Okay.
You want to just make sure that she tolerates it well in order to do the neck the next time.
Okay.
Yep. So she's doing good. Dip it back in, let it go up a third of the way.
Press.
Press. And now we're going to go the opposite way. We're never starting where we did the last pass. So we're going to go this way. And then since I went up this side of the face first, now we're going to go up this side of the face. So they call it cross hatching. You're just always starting in a different spot. And then down the nose.
It helps reduce the pore size, right?
Yep.
Oil serum.
All 5 of the face peels will help reduce the pore size. It'll help with collagen stimulation, kind of tightening up the skin.
Yeah.
They all help with anti-aging, but the advanced one's the best for anti-aging.
Yeah.
Yeah, and fine lines and wrinkles and stuff. But see how she is kind of frosting a little bit in these little areas?
Yeah.
So I'm going to watch that. Sometimes if there's like a clogged pore or like even some like acne or breakouts, they'll turn white. If it's just a little bit of frosting like that, you can go around it. But if this frosting was like a big area of the cheek, even if it's just one cheek, I would stop. But that's what frosting looks like, where it turns white like that.
Okay. Here have some small.
Yep. So she has probably some like clogged pores there.
Yeah.
That'll all come out. So she'll get like little white heads.
Oh.
And they come off just with cleansing. It's really like it because everything's just being pushed out. It doesn't go back into the skin. It gets pushed out. So it'll all come out. So that's normal. And then when they cleanse their skin, when she cleanses her skin, it'll all just wash right away.
Okay. So
and
wait.
it's starting to go down.
Yeah.
Yeah, I'm gonna
Wait
wait.
every 60 seconds.
60 seconds. Yep.
Okay, to apply the
Yeah,
next pass.
because it's just like little tiny bits of frosting, and it's starting to go down. I'm gonna do one more pass and see how she does. If we get more frosting, that might be it. So third pass, we're gonna go up. And see how she's not, it's kind of just sitting on the skin now. She's not absorbing it as well as she was on the first and second pass. That's normal. It'll start to look that way. And then bite your lips together. Thank you. Oh, bite them together. Yeah, see how it's starting to frost again? So I'm not going to do any more passes on her face. I'm going to have her lift her chin up, though, just a little bit. And I'm going to do a light pass under here and on her neck. Always include the neck when you're doing the face. You don't want them to have a different color face than their neck.
Yeah.
But with the face, that's as far down as you can go. Past the collarbone, that's body. And then I'm going to fold this in half like this. So long ways. And I'm going to get a little closer to her eye here. And then up right underneath her brow. And then flip it over and do the other side. Right underneath. And then do right underneath her brow. And we're gonna leave that at 3 passes for her. Since it's her first peel, it doesn't surprise me that she had a little bit of frosting. Because it kept frosting, I don't want it to spread. She's having a little bit of blanching over here on the cheek. You can see right here, this little area is starting to blanch.
Yeah.
So I think that one more pass, and I can see it kind of around her lip a little bit too. I think one more pass she would have frosted pretty good. And I try to stop that from happening, especially first time peelers. But yeah.
She don't feel pain or itchy?
She won't. None of them.
Okay.
None of them will, because the phenol in this is a numbing agent. So it'll numb them almost like numbing cream when you're doing injections. So she won't feel anything. So it's just really important to watch for that.
Okay.
You're watching for the frosting. You're watching for the redness. And then if the redness starts, like we say edema, when they start to swell, that's when you know that we're stopping, you know. And just because she hasn't had a peel before, and she started to frost right away, it's like, okay, we won't, you know, you don't want to torture them.
Yeah.
But she won't feel anything. Yeah.
So let's say if a patient can handle more passes. So
You
the
just
first,
keep going. Yeah.
yeah, but the first one is left to right, and second one is right to left, and then the third one up and down. How about the next?
Then you start from back, left to right, then right to left, and then up, and then that's how you keep track. Okay, if I'm on the up, that's my 3rd pass, and then once you get to that again, that's my 6th pass.
Yeah.
Some people will get all the way to 9 passes if
9
they have,
passes.
Yeah.
Oh, okay.
If they have a tiny little face, I've done 10 passes on someone.
Yeah.
It's just getting through this 5 ml. It's not that they got more of a peel.
Yeah.
It's just the 5 mLs. You know.
Yeah.
It's just getting through that.
Yeah.
Yeah.
Okay.
You doing okay?
Yeah.
Yeah.
So
And
all
see
the peels we use the same way. So right now we're using this. Which one do you think is like faster? Faster to kick in, and you see frosting like faster.
Advance is our most aggressive one.
Most aggressive one. Okay.
The advance is what you'll see.
Yeah. more. Original is more gentle, you
Yes,
think? Because
yeah.
first time peeler, and they don't have any pigmentation, just like gentle peel.
Yep. It's not
Skin.
gentle, but you can use it on rosacea and sensitive skin.
Oh, okay.
Yep.
It won't trigger like more pinkness or more red.
Yeah.
Oh, very safe for those people.
Yep.
Okay.
And then the Purify and the Purify with Precision Plus for acne, those have hydrocortisone in it, so it has a calming agent in it to kind of calm them down.
Oh.
Because acne can, be very inflammatory.
Yeah.
And so it's helping that inflammation calm down too.
Okay.
So that's what you're watching for that. Most people with acne will get frosting on their breakouts.
Okay.
It happens every time because there's bacteria in
Yeah.
there. So if they have especially a blemish that they've been messing with, and it's kind of scabbed, you can still go over that, but it'll turn white almost instantly. You just go around it. Since hers was kind of scattered all over, it's like I'm not going to keep going over something. I can't go around everything like that,
Yeah.
So
if it's a one like active acne, then we make it more frosting because it's become a scab. We want a scab, right?
Once it frosts, it probably will scab and peel because it already is almost like considered a wound. Yeah, because it's open and they've been messing with it. Honestly, if it doesn't scab the first time, it will the second, like the first pass, it will the second pass.
Okay.
And then if there's it, like let's say she had acne and there was a blemish here, 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 and they all turned white. If you can go around it, you can continue doing passes. Okay. Yeah. But if there's too much acne,
too many, like lots of small ones like connected, you can't avoid, then don't do it.
Yeah, then just stop.
Wait for next month to see how she recover and do the second treatment. Like
so it's pretty easy.
Yeah, it's
the application is easy. It's just watching. That's just the most important part, Just watching for those white frosted areas. And see, they're gone now. Yeah. It's the terminal endpoint. It's the skin saying, like, I'm going to peel, like, we're done. I can't take any more.
And we can't touch the lip, right? Not on
no
the lip.
Lips.
How about if patient have tattoo like this?
Tattoo, you can do, like, Aquaphor over it. I stay away from the brows altogether.
Yeah, otherwise, because it peel off part of the tattoo, too, so it become lighter, right? Yeah. Hair, it doesn't matter, right? It won't do anything to the hair. Okay.
Nope.
Okay.
But I don't ever get near the brows no matter what. But if they do have, like really, like a lot of that, you can put Aquaphor over that. Okay. They're really sensitive. You can put the Aquaphor around the corner of their eyes and around their nose and on their lips.
Oh, okay.
Yeah. But I stay away from the lips. I like to get in here because I think that there's a lot of congestion in that area. So I never put Aquaphor there. Yeah. And I don't go that close to the eye either. I've been doing this since 2012, the eye peel. So, I mean, my technique, I know where not to go. But if you're worried about it, just as long as this is squeezed out and it's not dripping, it's not going to drip into the brows or around the mouth or the eyes or anything. Right. So. Okay. And then this little area here, see how it's kind of still juicy? I just kind of pat it in here into the hairline.
It looks like some of the liquid is still on the top of the skin.
Yeah. So I just kind of pat, and then you can also feel she's kind of warm, and so I'm glad that we didn't do another pass, because that's what I let them sit for a little bit, and if you have a hand fan, they can kind of cool down a little bit. Yeah. They won't feel it though, as far as like any tingling or anything. At this point, she doesn't feel anything. Yeah. But then when you go in, you can feel like, okay, yeah, she was having not a reaction, but she was definitely heating up. Okay. So I guarantee if we had done another pass, she would have turned white.
Oh, okay. Yeah. But if we turn white, if we just put an actual layer turn white, we need to tell her, like, you'll be scabbing a little bit. Like that.
No, it's if you go over that again.
Over the frosting again, then it's heavy scabbing, like CO2 laser. Yep. Okay. Swollen.
So I've had a few accounts be like, what happened to her? And it looks like there's just scabs on her cheek. Yeah. And I'm like, did she frost? And they're like, no. I'm like, she had to have frosted if it looks like that. Okay. So that's what you're watching for, is that. So yeah, it will scab. It'll scab if you go over frosting.
Okay. But don't pick on it. Just like a heal, like self, like just like healing time is bad. Looks bad, like CO2, crazy looking.
So with this,
only
she'll start peeling. Today's Thursday.
Yeah.
Today's Friday.
Friday.
Yeah.
Yeah.
So today's day 1.
Yeah.
She'll start peeling on Sunday.
Sunday. Okay.
So day 3.
Yeah.
And then she'll be done peeling by Thursday, day 7.
Okay.
And it'll start right here on Sunday.
It's like really
and
the
then
skin, that you see the skin come off like that. Okay.
Yep. And so she'll start right here, and then it'll spread. So by day like 5, it'll just be like in her hairline. By day 7, it'll be gone. But if you go over frosting, it'll be at least 2 weeks.
2 weeks
of peeling.
The peeling. Okay.
It'll,
but does any patient just ask for the scapping?
No.
No, right? They wouldn't go that long. Okay.
Yeah. They don't want that. I mean, that is where you're going beyond medium depth.
Okay.
Yeah, our peel is medium depth.
Yeah.
And you're going to go way beyond that if they're scabbing.
Yeah.
Yeah. So
that's on
an
average for Asian people, how many passes you've been done? Like you think?
I mean, I've got up all the way to 9. The one that I got actually 10. The 10 passes I did was on an Asian client. She just had this tiny little face, and it was an Asian,
Oh,
and so
depends on how much that skin they have.
Well, I think because she had never done a peel, her skin was like, like this is enough after 3 passes.
Okay.
So the woman I did, the Asian woman I did with this tiny little face, and we did 10 passes, she had been doing all kinds of stuff to her skin. Like a lot of exfoliation, hydrofacials, peels, things like that.
Okay.
Her skin was very conditioned.
Okay.
Yeah.
Yeah.
So when I went in, it was like...
Okay.
Yeah.
Okay. Yeah.
Yeah.
I think that's all we need to cover.
Okay.
Well, how about if they have acne on the back? We use body?
Body.
Okay.
Yeah.
The back works good?
The back's amazing.
How about like if the patient have arm
you can use the body.
Okay.
Oh, it's amazing for that.
Okay.
You can take it all out for your client and show them.
Yeah.
So you've got the post-treatment cream, you've got your cleanser, and you've got your sunscreen. Just a pea size of each.
Yeah,
is enough.
very small.
Very
pea size,
small.
一个豆豆的 size. 回家的话就只能用这个 only. That's the only product you use at home.
Yep. And then you have 3 of these and 2 of these. So in 4 hours, you're going to cleanse your skin.
洗脸4个小时之后洗脸
And then use the green towelette.
用这个擦脸
Wait 10 minutes.
等10分钟
And then use the post-treatment cream.
10分钟之后用这个 post treatment cream.
And then an hour before bed, they have to be 4 hours apart though from using the towelettes.
Okay.
An hour before bed, so like 10 o'clock.
然后再4个小时之后10点钟左右对
Yeah, right? Because we've done it too. So 6 o'clock.
6 o'clock
6 o'clock she'll cleanse.
you clean and use the towel one time.
And then 10 o'clock, do this.
6点钟的时候
What time do you go to bed?
10点 OK 吧 She's OK 10 o'clock
10 o'clock?
Yeah.
Okay, cool.
10 o'clock
Cleanse.
再
Use
再
the
洗
white
脸
towelette.
然后用白色的一个
Then 30 minutes later, use
30
the
分
green
钟之后
towelette.
再用一个绿色的
And then use the post-treatment cream.
然后 post treatment cream
And then tomorrow morning, it's
明
just
天的
these
话
3.
明天早上是这
In that
洗
order.
脸 treatment
Yeah.
serum 然后 sunblock
And then tomorrow night, same thing as the night before.
明天晚上就
Last white
洗
towelette.
脸然后用白色的一次30分钟30 minutes later use
Yep.
green 30分钟之后用个绿色
And then 10 minutes later, post-treatment cream.
10分钟之后用这个所有的 instruction 都在这上面可以自己回去再看一下
可以
或者 download 那个
The
app
app has different languages too.
Oh, okay, Chinese too. Okay. You can download 那个 VIP 那个 app.
Right here.
Yeah, scan 一下，然后你的 day 1、day 2它会上面显示，
And it'll
然后
walk
这
you
个
through
box
everything.
上面是有这个二维码的，扫一下就知道你用的是哪个。So if she scan this one, this is the app or this is
Yeah.
for this peel. They know
No,
which peel.
no, it'll have you put in what peel you did.
Okay.
Yep,
So
and
this
it
is
says-
a Precision Plus.
Yep, it says right up here what you did.
Oh, okay.
Precision Plus.
Yeah.
So if it's advanced, it'll say advanced. If
Advanced.
it's original, it'll say original.
Okay.
Right here.
Okay.
Okay. And it says on the back too up
你
here.
也 download 一下，等一下你看一下，你 download 一下看一下里面什么，跟客人可以解释说，每个人都就 download 一下。OK，it's pretty easy.
Yeah.
Yeah.